welcome you guys. And again, congratulations on developing such an impressive platform. I know you've been working on it and have been diligently optimizing it, and you are revenue positive. You are having, patients are flowing through the platform today. So it is early commercial. Let's start with just the basics. What inspired you to create MyPhysicianPlan, and how do you think your approach can help address a lot of the challenges that we're seeing in the US healthcare system?
So when I was involved with primary care practice, we noticed patients coming in without insurance, and then they would say, how much is the fees? You say $150, $200, $250. Then they negotiate. Then you bring it down, and then you want to do some testing. They say, no, I don't have money. How much it costs? So you do some tests. You don't, and then you want them to come back for a follow-up. And again, that's how much is the fees, same amount, you can't do it. So there's a lot of disconnect. So what we noticed is we have people in our community who have healthcare, who have access to primary care and get the care done. And then we have folks, our neighbors and other people who don't have care, and then they're kind of bouncing around between emergency rooms or urgent cares or doctors. So we said, fine, this is not fair. We got to do something about it. So we came up with a primary care plan. We said the goal was to bring them at par with everyone else with insurance. So when it comes to primary care, everyone should have the same access, and it should not be that expensive. So the primary care plan helped us to bring these people at par with the rest of the patient population in the community. So we can provide the same type of care that we can with anyone who has insurance. So that was the idea, and that helped out. And when that got introduced at a facility, primary care facility, what we started seeing was not only the people in the community were using it, but people from, this is in New Jersey, people from Delaware, Pennsylvania, New York were coming in because they were saying, hey, this facility has a plan that incorporates the doctor's office, labs, prescriptions. So they were taking advantage of it. So that inspired us to do it. And then I ran into Gigi at Wharton and said, look, here's what I'm doing. Here's what's going on. Can we do something so we can expand and then offer it, nationwide? So that's how we ended up launching MyPhysicianPlan.
Brilliant. It's absolutely brilliant. And so talk about how this is different than traditional insurance models that we see across the United States.
So when Ramdev introduced to me this concept about 4 years ago, his key pivot was that, and that is what we ended up doing, is that by removing all the process and red tape, which in a way has now come in between in providing primary care. So before even the patient sees the doctor, there is like 10 processes which the practice has to do, so that makes sure that they get paid for the actual visit. And patients are also losing access simply because they are not able to qualify for all of these plans out there. So the number one thing that we went out doing is that we try to remove as much red tape as possible. So patients are able to sign up with us with no restrictions. Doesn't matter what your legal status is, doesn't matter if you have a job, doesn't matter what your age group is. Without any preconditions, anyone and everyone can sign up. And it's a simple 2-minute process. You go online, you sign up in 2 minutes, and you're ready. You can see a provider. We did the same thing on the provider side as well. So we have real-time tracking. Anytime a patient walks in at the front desk itself, they can quickly verify that the member is eligible. They are with the plan, and see the patient. They don't have to worry about CPT coding as long as a patient makes the effort to go and see the provider, and the provider is able to see it. As long as that is qualified, they get paid for that visit, and almost always within 24 hours. So by removing all that process, we were actually cutting so much red tape that when initially Ramdev ran the numbers, he was like, this is all it's going to cost us. It's going to cost us like $70 a month. And I was like, that is very cheap, and it makes it extremely affordable to a lot of people in the United States, especially 30 million people almost without insurance. And also a lot of those with high deductibles who are not able to make their primary care visits because it's super expensive. So once I ran the number, and also with my experience both on Wall Street as well as other startups, I knew like end-to-end what it takes to be compliant, what it takes to launch a product, what does it take to work with insurance, what does it take to work with patients. I was like, this can be done, and we can absolutely make it like much more affordable and accessible for everyone. And then it was more like, why are we not doing it?
Just to add to that, Stan, so if you see the significant difference between the traditional versus what we're trying to do, we have two types of products, right? One is the primary care plan that anyone can use and sign up, no restrictions, nothing doing. You can sign up today, you can see the doctor tomorrow. You can have it for a month, 2 months, whatever it is. And then you have the comprehensive care plan also. If you say, no, whatever specialists, hospitals and whatnot. So we have other product that they can use too. If you compare traditional versus what we are trying to offer, whether it's comprehensive care or primary care, even if you look at comprehensive care, premiums are 30 to 50% lower than what they're paying. So it's really appealing to small businesses also, to the employees. If the premiums are really high, they're saying, okay, this is an alternate model that I can use. And then when it comes to the deductibles, most of the plans have $5,000 deductible, and then there's $10,000 for the family. And then with this, again, the deductibles are $500, $1,500, depending on what they're choosing. So the out-of-pocket cost for the members is really low, whether it's primary care or whether it's comprehensive care, compared to the traditional models. So just like Gaurav said, the red tape is out, both for the members and the providers. Premiums are affordable. And then there's no deductible, the fear of deductibles. If you have traditional plan, if you go back to the doctor says, come back for a follow-up. Traditional plan says, okay, annual physical is covered. And then what if the doctors order some tests and those are not covered? And then if you want to come for a follow-up for the rest of the year, you have to pay out of pocket for those. So that's all taken out. The patients know that they have to pay only the copay when they go to the doctors, or when they go to other care providers, they're only paying a minimum deductible that they know that they're supposed to. So that helps the patients or employers or employees to choose this as an alternate option versus what they have.
Amazing. And so a little bit more to double click on that. One of the things that we're really struggling with in the United States right now is trying to ensure that patients have access to preventative care as well. And not just, sick care, but really trying to stay healthy care. And so how do you ensure that your members are able to access these kinds of preventative care and regular doctor visits without any kind of significant financial risk and significant financial cost that, usually, and time too, right? I mean, one of the beautiful things is that you're synchronous and asynchronous. And so you have this ability to save people the time they have to travel to and from the office, and then the time that they have to sit in the office. But how do you help patients mitigate those risks and the financial burdens that come with those?
So just like I said before, when it comes to traditional plans, what we have seen, other than the annual physical exam, everything comes out of patient's pocket, right? So when you want them to come next time for a follow-up, they have to pay out of pocket for any of those visits. So when it comes to preventive care or primary care, there's no point just providing a physical exam and then say off you go, and then we don't see you for the next rest of the year because they have to pay out of pocket. So now with this plan, what we are encouraging, and in fact we send emails, we send notifications saying, please, physical is out of pocket, is free. There's no free. I mean, the physical exam is free. There's no out of pocket fees. There's no out of pocket fees for the test. So please go visit. So by doing so, and when the patients know the only amount that's coming out of their pocket is a $30 copay or $24 copay, the complaints in terms of follow-up care, in terms of whether it's a chronic condition, visiting the doctors, or having the option for a televisit, because of all that, they're able to follow through. But compare that with the traditional options. If you talk to the primary care doctors, can I skip the 3-month visit? If you're a diabetic patient, can I come in 6 months because again I have to pay out of pocket? Can you reduce my test because I have to pay out of pocket? So those kind of things come in with the traditional plans, but that's not there with us. So that encourages the primary care part.
And because we cut so much red tape, both with even with the partners that we have, other providers like labs and prescriptions, we in a lot of cases actually have a lower out of pocket than even co-pays that traditional insurance plans have. So we have actually, even in that angle, we have reduced the price point much lower. Like most chronic visits, even for lab tests, they're probably paying like $10 to $15 in lab fees, which versus even traditional plans that will apply completely towards a deductible, and you're still paying like $60 or whatever, maybe sometimes even higher, like $200 just to get the lab test done. So we are cutting down the cost across the board, and our overall focus is that by reducing the cost tremendously and making it accessible and affordable to everyone, we can make it possible for everyone to get this care.
Which is huge, because right now we're seeing that is really needed. So, just to wrap up with a couple more quick questions here over the next few minutes, I think we would love to hear what your future vision is for MyPhysicianPlan and how you see it growing over the next few years, and some of the technological improvements, whether it's AI or something else that you're planning on rolling out to help this technology platform, really revolutionary technology platform, scale over the next 3, 4, 5 years.
So that's a great question. Yeah, go ahead, Gaurav.
Yes, a couple of things we're doing already. So one is that we did realize also, and thanks to the work that you guys did, that healthcare is complex, and it does look like in some cases patients are still getting confounded, though we try to simplify it and make it very easy. That we did realize that, so we are building on an AI component to help people navigate their healthcare better. That is also happening, but we are also talking with other healthcare players right now. So we are looking to see if we can, now that we have a large network of doctors in almost all the states in the United States, especially primary care. So we are looking to see if we can somehow integrate our offering with more larger health plans out there, to have more ACA compliant plans, which are more appealing to small businesses and employers. But we are working on both the directions to make sure that the benefits that we're able to bring in, we're able to help not just the population that we're targeting, but across the board to every American out there should be able to get, not just American, like anyone in the United States, be it whether you are here legally, illegally, or traveling, you should be able to access our healthcare services at an affordable and accessible price. So that is the vision that we're going for. And fingers crossed we will get there, and we're getting good traction from the market. So that's obviously very helpful.
Yeah, that's great. And tell us a little bit more about AI and how you see AI, as we've seen AI really start to become pervasive in every technological platform that we've studied over the last year now. How is AI going to help your platform scale and improve patient services over the next 3 years?
So to keep the cost low, and then also make it easy for anyone who's coming to the platform understand, we can't have a person answering the phone. We have some people answering the phone calls all the time. We have someone chatting. So that's again is going to add a lot of cost to us. And then we're really not answering and then giving everything that they need. So we are working on introducing the AI piece very soon. I mean, it's in staging at this point, but it'll go live. So that will really help out anyone who's coming to the platform in understanding various questions, or to the doctors who need additional support. I think that's going to revolutionize. And then we are also going to probably add some more intelligence into it, where if they have some common questions about their health conditions, also they should be able to get some answers too. So I think this is going to help us reduce the cost and also expand further.
Fantastic. Well, thank you both for your time today. Really appreciate everything that you've been able to bring to the program, and congratulations again on developing such a revolutionary platform for patients to gain access to physicians and medical consultations that they just haven't had access to before. Well done. Thank you both.
Thank you, Stan. Thanks for the opportunity.